here is the Australian Qualifications Framework itself, and again, in terms of what the Industry Skills Council does, we produce qualifications in the middle section here, as distinct from the higher education or the schools sector. Now, despite the fact that we do produce quals in the vocational sector and not the higher education sector, one of the things that we do really need to be looking at is, well, how do these sectors actually interface and work better together? How can they work better together for us to be able to provide the new workforce of the future? Look, I'll just touch on a few other sort of slightly technical areas about what we do. We produce the National Health and Community Services training packages. There is no training in those training packages effectively in terms of what we do. They include competency standards, and they're grouped into skill sets or qualifications, and they describe work roles and functions. So that's what the Skills Council does, and that's going to be the scope of the work for this project as well. The delivery of training is undertaken separately by training organisations, and the standards we produce now will be used as the basis against which individuals are assessed by training providers. So there's a separation there about development of the standards, which we do in consultation with industry, and then training is delivered separately by the training sector itself. So that's an important separation, and that enables us to ensure that the outcomes of training are industry driven. We produce the health and the community services training packages, and look, in terms of the outcomes of this project, we are looking at competencies that could, or skills that could be used by the broader health and community services workforce to see better oral health outcomes in the community. And those skills could be used by aged care workers who are in the red one, the community services training package, or enrolled nurses or Aboriginal health workers or allied health assistants who are in the green one, the health training package. So the outcomes of this work we think might cut across both these packages. In your satchels today, you would have received a copy of the Industry Skills Council's environmental scan for 2009. I'll just draw that to your attention. It's a document that we produce on an annual basis that captures data about supply and demand of skills in the community services and health industries. And based on that information, we then look at the training packages, how they're performing and how they should be changed to support workforce development needs. So we produce that on an annual basis. I encourage you to have a look at it, and we're currently in the process of working on development of the new scan due to be published in March next year. So I would encourage any of you to make a submission to that process as well. And there's a survey on our website, or you could just contact us directly. And so we're certainly very interested in hearing from the peak and professional bodies. Look, this chart just goes a bit beyond the AQF, and we highlight this diagram in the environmental scan. And look, what we're just profiling here is we have the vocational sector and the higher education sector, and the section down the centre identifies that, well, we do have competencies is what we produce. And look, we think that in terms of seeing the vocational education and training and higher education sectors working together better, we think the competencies that we produce out of the packages can be equally used to develop skills of the workforce, or of workers who might be predominantly trained in the higher ed or the vocational sectors. So potentially out of this project we may see competencies that are able to be used by registered nurses or enrolled nurses or Aboriginal health workers, work roles that are differentially established in those two respective sectors. So I'll leave it at that in terms of a background to the Skills Council, and we'll come back to the aims of the project. But again, essentially we are proposing to examine and identify core oral health competencies and skills required by the broader community services and health workforce, and see where we can build on those to ensure better oral health outcomes. So I'll leave it at that at the moment, and I will hand over to Margaret Thornton, who's going to be our chair for this first session. So thank you, everybody.